please state your name and what you do and where.
My name is Derick Miranda. I'm one of the pharmacists at Truman Medical Center in Kansas City, Missouri.
And in your practice, what are the three main types of pain that you deal with?
I actually do medication reconciliation and discharge education, so I see the full gamut. We have a large population of sickle cell patients. We do have a lot of diabetic patients as well, so we see more of that neuropathic component, as well as I do have some interaction with the surgery team. So we have some of those acute bone breaks, things like that. So I see a large variety in my clinical practice.
Right. And what are the challenges in dealing with pain management for you?
First, we serve as a safety net hospital. So one of the challenges we have is long-term being able to follow up with our patients in a consistent manner to help be able to consistently reevaluate their pain. Also, for a lot of our patients, we have a problem in terms of getting them out the door with a medication regimen they're able to be able to get a hold of consistently. So a pain regimen that works great for 2 weeks, although is not nothing, we want to make sure that we can have something that we can find that's consistent. Also, help make sure that their pain is controlled in the long term as well.
Right. And do you attend other conferences?
Oh, actually, I have just been in practice for 3 years now. I have gone to some conferences for pharmacy-related things, but this is my first interdisciplinary meeting, and I'm loving it so far.
Oh, well, that's good to hear. Any courses stand out in your mind?
I saw a lot of the behavioral components and the management of psychiatric disease, depression, and suicidality. I thought it was very interesting because I feel like, at least as a pharmacist, we focus so intensely on medications. So seeing the other components and seeing what I can do in my clinical practice to help ensure that, are we doing appropriate depression screenings? Are we making sure that we're having conversations with patients? How is your mood? Do you know that your mood affects your pain? A lot of that information linking back to making sure you get a whole picture view of the chronic pain patients, I thought was incredibly helpful.
Oh, good. And what do you think of the look of PAINWeek? Our posters, that sort of thing?
Fantastic. I was actually speaking to one of my colleagues about this, who's also from Truman Medical Center. I think they're very, very interesting. I think it's a great way to catch someone's eye who's walking by. It's like, oh, hey, I didn't notice that we had that one on the list. Maybe I want to go check that one out. And all these little, the flyers that we have here that promote about all the different variety of classes, I think it's a great way to provide the information that's available, also letting the person individualize what they're hoping to see, but also see what all is out there as an option.
Right. It sounds like we might see you here next year.
I'm hoping for it. Knock on wood.
Oh, excellent. Are you familiar with the Certified Pain Educator?
I am. Yeah. My colleague is a certified pain educator, and I'm hoping to gain a little bit more experience myself, so hopefully I can be taking the test in a few years once I become eligible.
Oh, that's wonderful. Thank you for talking with us.